Hi, I'm Dr. Narendra and this is Dr. Nicholas Wyatt, and we are co-founders of Synergy Therapeutics, the evolution of nature, the revolution in science, and the dedication to optimizing health with supplements that are powered by nature and proven by science. Sure. The correlation of vitamin D and calcium intake is a very important question, and in fact the whole issue of calcium replacement in the human body has to be taken to task and to question. There's numerous data points from the world literature, including the China study by Dr. T. Colin Campbell, who is one of the world-renowned researchers in nutrition and health from Harvard, which indicates that the calcium level that we need is between 200 and 400 milligrams of calcium, not the 1,500 milligrams that's been touted by the American dietary associations because of huge lobby boards. And let me explain to you why, once we have enough vitamin D, the amount of calcium we need actually decreases. The best example I can give is looking at iron tablets and iron replacement. If you take iron without vitamin C, you would absorb the iron, but only at a fraction of what you would absorb if you took the vitamin C. When you take iron with vitamin C, you increase the absorption of iron into the human body by 60 times. That would be akin to taking 60 tablets of the iron to replace it with just a simple vitamin C additive. Now, the same goes for calcium. You can take only 200 to 500 milligrams of calcium, which you can easily get in your diet, and as long as your vitamin D level is adequate, you'll absorb the entire content of that calcium into the human body. And therefore, the issue of not having extra calcium, but in fact having an optimum amount of vitamin D that you can obtain from Synergy Therapeutics D10, which is a 10,000 international unit D3, is the optimum amount of vitamin D to assure calcium stability in the human body.
So another question that we commonly get asked with the vitamin D10 is, well, I have osteoporosis, and so I've been told that I need more calcium because my bones are, I'm not absorbing enough calcium and my bones are deteriorating. I think that it's important to realize that osteoporosis is probably a disease that we created by walking around with vitamin D deficiencies. It's important to understand that when you have a vitamin D deficiency, this communicates with an organ in your body that communicates with the cells to eat your bones. And so when you walk around with vitamin D deficiencies for many years, it's no wonder that you get diagnosed with osteoporosis or brittle bones. And so by simply increasing your vitamin D or taking the vitamin D10 to make your levels, to produce optimal vitamin D levels, then you can reduce your risk of osteoporosis, because that reduces the risk, reduces the activity of the cells that eat away at your bone. And therefore, like Dr. Dougal was saying, you really don't need more calcium whenever you have osteoporosis. What you need is sufficient levels of vitamin D so that you can absorb the calcium in a sufficient manner and utilize the calcium on the bones, as well as decrease the activity of the cells that eat at your bones. Thanks for joining us on Synergy Therapeutics YouTube channel and some great discussions about the products that Synergy Therapeutics offers. Again, I'm Dr. Nicholas Wyatt and this is Dr. Narendra Dougal. And remember, Synergy Therapeutics offers the only products that have been powered by nature and proven by science.